I have another rant today about bad doctors, and boy, do I have a lot of bad doctor stories. And I'm not perfect, I make mistakes too, but it's sad. Why do I have to double check everything a health professional does? Why do I have to double check all the medications? Why do I have to double check everything they say? And when there's basically discrepancies between me and a doctor, normally I'm right 49 out of 50 times maybe. And it shouldn't be that way. You should be able to trust. But honestly, again and again and again, I have to go through the prescribed medications. And again and again and again, I have to really think hard about the management or the diagnosis or what the recommendation is because the recommendations are wrong. And the doctor is working too fast, or they don't have all the information, and they're human, and mistakes happen, and it's just sad that you can't trust these health professionals fully, and you always have to sort of double check things. And my first story is about my baby. Oh, my baby girl, she's so cute. She's so cute, and she's a big baby. Of course, this is in Indonesia, so you can imagine a big European baby, and you have all the tiny Indonesian babies. You know, her baby, our baby, was over 4 kilos, and all the other babies are, 2 kilos. Just giant baby. So keep that in mind. So she goes, get some vaccine injections, and just overall checkup. And I wasn't there, but the doctor looked, they weighed the baby and was like, oh, that's a lot for the baby. Maybe more tummy time, your baby's overweight. So I hear this getting home and I'm like, my baby is not overweight. She did not call my baby fat. And there's graphs for this. There's graphs for this. There's graphs of, age of baby and weight. And sure, if you go by that graph, the baby is 2 standard deviations above the average weight. So that's like, what is that, 97% of babies are lower weight than my baby. So my baby is a heavy baby. There's other graphs and statistics for weight versus length. And she's right smack dab in the middle of normal. She's average. So how dare that doctor call my baby fat? No way. Now my second story is about myself. And I had a concussion last, I think, December. And I'm still suffering with it. What is it, like 9 months later? And I've had a real hard time concentrating ever since the concussion. And I can even look at my videos, some of my videos, particularly my lectures for my ultrasound training. I would record maybe 30 minutes, 40 minutes, 45 minutes before making a mistake or cutting that recording, and just all continuous. And now if I record, half an hour long, and it'll have something like 100 cuts, 200 cuts, and many, many, many attempts just to record something, because I lose my train of thought. Sometimes it takes me 2 or 3 attempts to brush my teeth or my showers. I sometimes wash my hair, I think 2 or 3 times, because I'll be going to get out. Wait, did I wash my hair? Did I put shampoo in my hand and just walk out of the shower? Did I? So I brushed my teeth, and I'm like, did I brush the lower part of my teeth? Like it's really this lack of focus, and it's, honestly, it's the story for why my second, third, and fourth books aren't done. 2 books over half written. One of the books is over 50,000 words, and honestly, I haven't worked on it in almost a year now. And the work is slow just because I get intimidated starting projects, because I get distracted so easily. So it's affected my ability to get things done because working on them, it's very frustrating. So I need help at this point with focus. And using my father's advice, look up what you think you have, look up the exact definitions, and say only that to the doctor. So you get the right diagnosis. Sadly, he's not really wrong. So I tried to do that. I know what's wrong with me. You look up the DSM-5, and actually I recommend you do that if you have psychological issues. DSM-5 is the guidebook for how to diagnose mental conditions. That is basically the Bible. It's like 1,000 pages. It's very detailed, and that should be what the psychiatrists are following when they make a diagnosis. And for the diagnosis for attention deficit is, I think it's 9 criteria, and you have to meet like 5 out of 9 criteria, and I think I met 8 out of 9 criteria. So that was my problem. I clearly meet the criteria for this diagnosis. I'm not really looking forward to the treatment. tends to be amphetamines and amphetamine-based drugs. But if that can help me finish my books and finish my projects, and I enjoy life better if I could sort of get my projects sort of done, and I can get my life sort of organized a little bit better. So I book a visit with a psychiatrist, and I say, I can't focus, can't concentrate. I get anxiety because I know I can't focus and can't concentrate. I can't finish projects. I get distracted way too easily. I can't finish making a meal. I can't finish brushing my teeth. I can't finish showering my head and washing my head. I get distracted so easily, and it's measurable. My typing speed, my recording videos, I can measure the difference. And at this point, I need help. What can we do? What can I do? She asks, well, have you been prescribed drugs before or diagnosed with this in the past? Well, no, the concussion was just, less than a year ago. And I was prescribed drugs in the past. I didn't take them, but that was like 20 years ago. I had depression. It was some sort of SSRI, and I didn't take it. Instead, I got counseling instead. She's like, okay, yep, okay, we're done here. I picked out a drug for you. Just get that and take that. So, what did she prescribe me? I'm not sure if it was an SSRI, but it's just a serotonin-based drug for depression. I don't have depression. She didn't ask me any questions about depression. I didn't say anything about depression. I have a baby. I spend hours every day smiling so hard my face hurts. I do not have depression. How dare she even insinuate I have depression? I have a baby. How can I be depressed when I have a baby? Now, I know some people do get depressed when they have a baby because it changes their life, and I'm not saying you can't, but I'm not depressed. She didn't ask any questions. But what does a doctor hear? The doctor hear, oh, diagnosed with depression. Doctors don't assume people get better. Oh, diagnosed with depression, still has depression. This is probably just a side effect of the depression, making links in their head. Now, to her defense, she did prescribe me an antidepressant, which has been shown quite recently that's pretty good at helping with people who are depressed with cognitive difficulties. So she picked an antidepressant which actually matched my symptoms, but I don't have any depression symptoms. That's a big part. Don't just assume I still have depression from 20 years ago. So I waste a whole bunch of money and time booking the session with a psychiatrist, and I'm still back to square one. I've just wasted the money. But it's all what the doctor hears and that thought that's going through the doctor's brain, right? I have another example. I had a bad parasite infection last year. Not that the doctor pointed it out or figured it out, but I did have sort of persistent gastrointestinal issues and fatigue following a bad fever and muscle pains and headache. And so I booked a doctor appointment. And at the end of the visit, I had, like 6 or 7 prescribed medications or recommended medications or supplements. And a lot of doctors have this thought of a pill for every ill. They don't say it that way and they don't think of it that way, but whatever they hear, oh, headache, this pill, fever, this pill, diarrhea, this pill, this pill, this pill, this pill, this pill, one on one or 1, 2, or 3. And so I go through the list, and this is what I recommend everyone do is you take your medications, you go to drugs.com, and you talk to your pharmacist, or ideally you talk to your doctor, because you need to make an informed decision about whether to take these drugs or not. And honestly, people don't make an informed decision. They just do what their doctor says, and their doctor might be making a mistake. So talk to your pharmacist. By law, in a lot of countries, pharmacists have to answer your questions when they hand you a drug. So take advantage of that feature and find out what these drugs are, what these drugs do, what are their side effects, and you can see whether they're worth taking or not for you. And if you're taking a drug and it's not working, stop taking it. Well, with the caveat that some drugs you can't stop taking suddenly. So again, talk to your pharmacist, talk to your doctor. And the other thing is that and then, of course, you have something like antibiotics, which you shouldn't stop because you really want to eliminate all the bacteria. You don't want there to be survivors that will adapt and come back being resistant to the antibiotics. But if it's not one of those two, if you're taking a medication and it's not helping or it's making you worse, then stop taking it. So anyway, I went through the list of, I think it was 7 things. It's like, okay, this is an anti-headache and this is an anti-fever, but I had a headache, I had a fever. I don't have those currently, so I'm not going to take those. Could you imagine I just blindly took everything that was on the list? right? It wouldn't make any sense. And maybe one more story. When my wife was pregnant, first trimester, went in for a checkup and was handed a list of blood tests to get. But when I went through that list, a lot of those tests could be eliminated if the doctor just asked questions. And a lot of those tests shouldn't have been ordered in the first trimester. They should have been ordered in the second trimester. But of course, the way doctors learn, it's like, okay, this is the list. This is all the tests during pregnancy. This doctor had just simplified everything that I need to order these tests, not why I need to order these tests. If they knew why, they could have asked questions to determine whether they needed to or not. Anyways, I think that's enough ranting for today. Cheers, everybody.